Excessive sodium intake has been linked to high blood pressure, stroke, and heart disease. Yet many Nigerians consume between 7 and 9 grams of salt daily, far above the World Health Organization recommended limit of 5 grams.
This excessive overconsumption of sodium is directly tied to the alarming rise in hypertension, now affecting over 35% of adults in our population. The situation is exacerbated in urban areas where dining habits lean heavily towards saltier prepared meals, unconsciously risking our lives with dietary habits that could lead to devastating long-term health consequences.
And we strongly believe that the effective implementation of the National Guideline on sodium reduction in Nigeria will help in no small measure in reducing excessive sodium intake among the populace and thereby reduce cases of cardiovascular diseases and non-communicable diseases in Nigeria.
Health experts emphasize that public awareness and behavioral change will be key to the success of the initiative.
This is the first time Nigeria is coming up with a guideline on sodium reduction. What this generally means is sodium is actually, excess sodium is a risk factor for cardiovascular diseases. And the country had deemed it necessary to begin to look at approaches that would reduce the consumption of excess sodium in the population.
The launch is all about sodium reduction in Nigeria. And since last year, the Ministry of Health and Social Welfare, alongside other partners, have been working tirelessly and with so much efforts, in developing a sodium reduction guideline.
This is a show that we are calling, on other government across the region to be able to stand up to this reality of the burden of non-communicable diseases in our society, and also be able to come up with guidelines that are very important. And one thing I would also like to mention that is a cost-effective measure, because when people are healthy, they pay less in seeking medical care, or they pay less hospital costs.
As enforcement begins, collaboration between government agencies, food producers, and consumers will be crucial in making this initiative a lasting success.